2. Welcome everybody to Healthy Seminars, healthyseminars.com. I'm your host, your moderator, Lauren Brown. I'm a doctor of traditional Chinese medicine. I practice in Vancouver, British Columbia, Canada. I'm at AccuBalance Wellness Center. We're recording this during isolation, so actually I'm not officially practicing in my clinic these days. We've been closed for a while. And we started putting together a series of lectures back in March 24th, and it's really grown in such a positive and good way. Our intention was to create community, so community, unity, immunity. So bringing people together, having our cameras on, and then at the end of the session, open up our mics so we can talk to each other, and to create education. So we want really good educational content and to see everybody and create community. And the feedback from you guys has been wonderful. And so we keep doing it, right? Because it fills us up when we get all that awesome feedback as well. The series we're doing today is called Classical Chinese Herbal Principles in Action in Response to COVID-19. Remember, it doesn't have anything to do with treating.
Sorry, I couldn't quite hear you.
Oh, somebody's Siri. I'll mute that. It doesn't have anything to do right now with COVID-19. It's using the Chinese medicine principles. And so that's what this series is about. Principles as in what's presenting in your clinic. So it doesn't matter what the name of the virus or disease is what is the constitutional issue, how are they presenting? And so there is no herb, there is no formula for the virus because you're not treating a virus, you're treating the individual. And so what is the right fit for that individual? And that can change throughout the disease process in that individual. Today, we're going to have, in a moment, Sharon Weizenbaum, who kind of got this series started, and her colleagues and students have been doing these presentations. This is number 6. And then today, our presenter is Carolyn Radice. Right? Did I say it right? Radice. Close enough. So she'll be our speaker today. I want to do a little housekeeping. And as I do this, I'm going to remind you guys that if you want to ask questions at the end of the presentation, digitally do raise your hand. This is our resource page. So you can find this on the home page anywhere. Go to resources. Just to let you know, replays can be found on this page too, the links, and that's right here at the top. And then we have just basically sections. So you can go to your categories here. We got telehealth, Conscious Tuesday, all these fun things. And then here's the Classical Chinese Herbal Principles in Action. So you can click on that. Shows you our schedule, and this is where you can register for what's happening today. And if you want to watch a replay or etc., see here, replay, you can click on this link, and it'll take you to another page. And I just want to let you know that this is number 6, and I know we have a lot. Like today we have 2, so we have number 6 and 7, and then we have another one this Friday. And people really want to watch this. And so our intention has been and still is, we want community. We want you to come to the live webinars. We really don't want you to watch this in isolation. We want you to watch this with us. And we want you to get the information and not have it sit on your shelf. And when things are free and forever, people tend to just keep postponing it. And that you never end up watching it. And so we've been putting these short timelines on it. What we've done for this, because people really want this, and I know it's really important because you have family and friends that may be struggling and you want to be able to support yourself for them. And so we have put all the replays up. So you may not know this. Well, there's all the speakers, by the way, that are doing the series. So here they all are. This was the last one we've done. So they're all on this page, and they're going to stay on this page until April 30th. So now is your opportunity to catch up. Come to the live, and you can catch up on these recordings. So I just wanted to let you know that exists now, and they're available on the website. Do check out that resource page because we have something every single day. We have 2 today, we have something on Wednesday, we have something on Thursday, we have 2 on Friday. So do check out the resource page for that as well. I want to let you know that what has come out of this series is some mentorship. And so the presenters here, the majority of them, through whitepinehealingarts.org, you've got to contact through them. But a lot of people have cases and they're looking for extra support. And so they're offering some one-on-one mentorship with your cases. So if you're hearing all these presenters, do go through whitepinehealingarts.org and they will connect you with one of the presenters to help you with a case. I just wanted to share that with you. And also I want to let you know, along with these free resources that you're watching today here on the live webinar, we have several courses that are approved for CEU on demand in the herbal area, especially if you're doing telehealth, but just in general, if you want to fine tune your herbal skills. So speakers like Sharon Weizenbaum, she has a series of courses. They've mentioned Dr. Feng Shui. He's got some courses on there as well online, and Huo Wang are on there as well as many other herbalists. And during isolation until the end of April 2020, all those courses are on sale 25% off. So the website on demand is on sale for 25% off to the end of April. Just want to let you guys know that in case you want to study more with these people on demand. And Sharon also has an amazing graduate mentorship program. Again, you can find more information about it at the whitepinehealingarts.org website. And many of you have been taking advantage of her diagnosis course that she has on healthyseminars.com on demand. It's about 54 hours of continuing education credit. And we looked at, many of you are taking advantage of it because you get the 25% off. And if you bought that clarifying diagnosis version when it was 19 hours or 20 hours on the Pro-D Seminar Legacy site, we are refunding you that amount that you paid way back when on Pro-D for this upgraded, updated version. And so we worked it out for some of you. If you paid full price when you bought on Pro-D, it's over 75% off when you put the 25% coupon plus the refund. And so I'm not surprised many of you have been registering for that course. And if you like the pathophysiology, how Sharon and the speakers have been explaining it, it's 54 hours of really going deep in that. So I just wanted to share that with you. Last thing before I hand it over to Sharon and Carolyn is our disclaimer. Please realize this is for educational purposes only. This is not medical advice. This is not intended to be medical advice. If you have a health condition, please seek out a healthcare provider. This is for educational purposes only. All right, thank you for that slide. Now, without any further ado, I bring you Sharon, who was the brainchild behind this, and she can introduce Carolyn. Thank you.
Yeah, so I do want to mention again that most of the speakers who are presenting in this series are available to give private mentoring, and you can contact them through the link that I put in the chat. And also that if you want to look at the presentations by some of the speakers who are doing mentoring, it's so great that Lauren put those talks back up, like the talk by Sally Rappaport and Suzanne Canole are back up again, and they are available for mentoring, and people have already been using that service. So, and then I also want to mention that we have something coming up that will probably be unveiled in about a week, which is we're trying to figure out what to call it, like a forum or a salon where we're going to be able to put up our cases, right now, upper respiratory cases and cases related to the virus. And we'll have a salon where people can come in and have discussion about the cases that we're seeing with some senior practitioners and ask questions and give insights. So that will be coming up as well, and it will be accessed through the Shenlong Society site. So keep your ears open for that as well. So Carolyn Radice is a good friend of mine and a colleague, and she's just, I always think of Carolyn as being smart as a whip, just super sharp. And so I'm really looking forward to the talk today to experience her teaching. She's a very experienced teacher and a real classic formula nerd, just in love with classic formulas and very experienced. So I'm excited to hear her presentation about Huo Xiang Zheng Qi-san. So without further ado, Carolyn Radice.
Thank you so much, Sharon. I first want to thank Lauren, Sandro, and his whole team. This is such an amazing community you've been able to bring together, and I couldn't be more grateful. I have not missed a single one of these presentations. I plan to continue. I have a bunch queued up that I haven't seen yet that I'm super, super excited to see. And for most of us who have been away from each other for close to 6 weeks now. It's really been an amazing community. So I'm thrilled to be a part of it. And thank you, very special thank you to Sharon for her very kind words, but also for her mentorship. I have started studying with Sharon more than 20 years ago, and I have evolved with her as a practitioner, as a friend, and I'm so delighted to be included in this. And she really has this special ability to make the medicine accessible. So when most of us were going to school, we came out with a lot of language or information that maybe didn't completely make sense when we were working practically with patients. And she was one of the first people that used these beautiful metaphors that were completely articulate, but also very tangible. When you were seeing patients, you could say, I see how this principle applies to this person that I'm seeing. And my deep dive into classic formulas kind of started with her. I've gone into deeper study with some of the Feng Shui Lun methods in Jingfang, and a few other teachers who I have really learned a lot of helpful components to the way that I practice today. But everything goes back to Sharon. It seems like a full circle goes back. So she really is an incredible resource, and for her making this available on her site as well as going forward. So part of what she was talking about is a brainchild of the SHANG Society, which I am happy to be a co-founder with Sally Rappaport. Marnie's here today. Suzanne is one of our members who spoke the other day. And we are launching to a bunch of beta testers. Some of you today may be some of those beta testers. Our first attempts pass at gathering information about the patients that we're seeing who have this virus and how we're actually treating them clinically, which of course is challenged because we only can use telemedicine for the most part. I'm practicing in a very close suburb of New York City, so I won't be back in my office for a while, but I have been doing a bit of telemedicine and using a lot of the formulas that we've been talking about so far in this series that are based on the classical presentations that Sharon has talked about and taught with us. So what I would like to introduce to you today is a formula that is in some ways a classic formula, but in other ways not the same as the ones that we have been talking about. And this is Huo Xiang Zheng Qi. Huo Xiang Zheng Qi, I'm calling patchouli powder for a reason I will refer to a little bit later. But what this brings to mind is this dichotomy that sometimes form, but really should be better aligned between formulas that are sourced from Shanghan Lun and formulas that are mentioned in the Wen Bing. And if you have the opportunity, if you have not already visited Sharon's White Pine Institute blog, she's written several really wonderful blog posts, a new one today, which I could not recommend more. I haven't been able to read in total detail yet, but talking about how we can use principles from any system as long as they make sense for our clinical practice. So the formula today is one that is being used quite a bit with patients in the throes of the virus. It is not a Shanghan Lun formula though. Huo Xiang Zheng Qi, unlike the formulas we've talked about, like Ma Huang Tang, Wei Zhi Tang, Xiao Chai Hu Tang, Bai Hu Tang, which are really classic Shanghan Lun formulas that are based on Shanghan Lun principles. Huo Xiang Zheng Qi was actually written about 1,000 years later. So the earliest writings of Zhang Zhongjing, as you know, were Eastern Han Dynasty. Huo Xiang Zheng Qi is more of a Song Dynasty formula. And a lot of the authors that put together the series of writings that became the Wen Bing 700 years after the Song Dynasty incorporated a lot of the formulas that we talked about as Shanghan formulas, formulas that were developed in response to many epidemics that China experienced over the course of the centuries between the Han and the Song Dynasty. And there's a lot of dialogue about what were the limitations of Shanghan formulas and how can we go beyond those? How can we develop these theories? One of the things that Shanghan diagnosis and Wen Bing diagnosis share in some of the classic ways that we teach and talk about it, and this is something that Sharon has spoken about quite a bit, is viewing our bodies as something other than what is in the rest of the universe and how we need to protect ourselves from this invasion. And that Shanghan in its purest sense is only about cold disorders and Wen Bing is only about warm disorders, which we know is absolutely not true. Because of course, as we look at the circle of the Shanghan theory and how Sharon describes and talks about this cycle of transformation, how the organs actually function to keep our systems resistant, to keep our systems strong, because we get sick if something inside of us is not functioning properly. So what we are actually treating is dysfunction in one of these conformations in Shanghan theory. And if we can make all of these function properly, then our experience with the virus might be very different. So we're not treating the virus, as you know, we are treating the patient. And who are the patients that we are seeing that have different conformation challenges? So Sharon talked about, if you can picture her little spinning wheel in the center of this cycle, the Taiyang conformations, where if Taiyang is performing properly, it functions to open and expand the body. So if the outward opening function of the body is working properly, then the Taiyang is functioning properly. As Sally presented the Ma Huang Tang and the Guizhi Tang formulas that will treat dysfunction in that opening and expanding. Yang Ming channel theory envelops this idea that the downward direction is blocked. So as we open up, we now need to change direction and come down. If there's obstruction in that Yang Ming descending, that's when we will see the formulas that Sharon spoke about, like Bai Hu Tang, very classic clearing heat formulas. Obviously, not a cold theory. Yang Ming is all about these excess heat patterns. And then we had the pleasure of listening to Suzanne's lecture on Shaoyang as the pivot theory, how we use classic formulas like Shao Chai Hu Tang to help transform the Shaoyang pivot to go within. And that's kind of where we're moving in today, is the yin channels. The first transformation comes through the Taiyin, and that is where we're going to see a lot of the pattern presentations with especially early stage disease and certain types of patients that's going to bring this formula into account. So the yin channels are fairly different in that they're not this active, moving, correcting principle, but more about consolidating, containing, and supporting body function so that it can actually continue to move in the four directions properly. Moving into Wen Bing theory, which if you look at the way that it's described, it's still, again, this idea that we have an outside and an inside, and that we have pathogens that are attacking us either on the outside or the inside. And how do these principles actually work for us when we're treating patients? So exterior patterns are going to be similar whether you're talking about Taiyang presentation or you're talking about Wei level presentation. But Wen Bing developed with the idea that most patterns were really about heat presentations. Some level of the body, some part of the body, be it the exterior of the body or some levels and some other parts of the body, were very stagnant and created heat patterns. So a lot of the teachers, practitioners that I've worked with, that I've studied with, have really followed a lot of Shanghan theory, and that makes sense for a lot of the patients that I work with. Wen Bing theory is not one that was, I think, very well taught or understood or explained, this idea of the four levels. And Wen Bing is not so much in a practical sense about a location in the body, but really about how we experience different levels of stagnation. So they have this idea that you have four levels from out to in, and also that you have effects on the triple burner and how you communicate from upper, middle, and lower burner, and how these sort of work with pathogens moving through your body, which may or may not be helpful in your understanding of how the medicine is going to work for this virus. The one doctor that I have studied with for some time that actually uses Wen Bing theory almost exclusively, if you have studied any dermatology or want to, with Mazen Al-Kafaji, who will be starting another series of his 2-year internship lecture. His theories on Wen Bing, based on dermatology, really use the language of Wei level diseases and Qi level diseases and blood heat diseases that apply specific to dermatological presentations. And I think there is some incredible responses that patients have to his applications. He's really a remarkable teacher if you get to study with him. He is one of the few exclusive Wen Bing teachers I know. I know a lot of people operate with Wen Bing principles in their practice, but it's one that's always been a little bit trickier for me to wrap my head around. So I'm going to try to walk with you today through how we use some of the Wen Bing presentations and apply them to some of the other classical theory that preceded it by almost 1600, 1700 years, because nothing in Wen Bing really did not start with Shang Hanlun. So our diagnoses and our applications are going to be very similar. So let's look at how warm diseases are described in the Wen Bing. So they describe them as being present on one or more of the four levels, as we described, the Wei, the Qi, the Ying, or the Shui. So is this an internal disorder, an external disorder? What dysfunction in the body is impairing movement and creating this heat presentation? And what does that look like? And, or as I mentioned, the triple burner moving through the systems of fluid transformation in your body. What we want to think about is really, where is the obstruction in the body? How are the symptoms presenting, so that we can apply our principles as well as our formulas to this presentation, because we can only treat what we can see. Some of the other theories of warm disease, as I mentioned, describe how externally contracted warm heat pathogens, which sounds a little bit redundant, are the cause of the illness. And really, are we thinking more about how the body is in some type of disharmony or how we are being attacked? And however it makes sense to you as a practitioner is the correct way for you to proceed. But working with some of Sharon's principles as she teaches them in the graduate mentorship program have worked well for me. So I'm going to try to figure out how we can fit some of these principles into that system. So where is the regulation or the processing not functioning well? On the exterior, on the interior, where on the interior, the upper, the middle, the lower? Another part that's intrinsic to warm disease theory is the idea that diseases that are classified as warm diseases, which make total sense in the context of this pandemic, infectious and epidemic, we are living it. We are living infectious pandemic presentation right now. So you can see why warm disease would make sense in terms of its application. There's also a lot of discussion about how the pathogenic presentation is seasonal and geographic. The seasons, I think, become a little bit more relevant in some contexts. They're described in the Wen Bing in a couple of different ways. They talk about pathogens being sharing the manifestations of different types of pathologies, which will sound similar to you, but that they have a tendency to present in certain seasons, so that we would see wind warmth diseases, usually occurring spring and winter. And these would be sort of what you might experience historically in your lessons as a wind heat pattern or some type of exterior pattern that has heat associated with it. So Wei aspect or upper burner diseases. Summer warmth or summer heat diseases, they describe as diseases that manifest after the summer solstice. These are some of the hottest presentations. They often harbor dampness, so they're often these hot, humid types of climate that can induce these types of pathologies. And those usually manifest in the Qi aspect. Damp warmth diseases, with the emphasis on the damp, which is where we're really going to focus today, exists in all seasons. It is said to be stronger between the summer and the autumn when dampness and heat steam together. But this sort of seasonal relationship, as well as pathogenic relationship, factors into how we're seeing this manifestation, according to some people, is that when the seasons are not presenting in a way that is expected. So I live in the Northeast, where we had approximately a half an inch of snow all winter. This is a very warm, very wet winter for us. And is that related to the epidemic that we're now seeing? According to the Wen Bing school, it is. It is being seen as a seasonal pathogen outside of its right relationship with the universe, and how we are responding to it with our body's ability to function within that may be part of the etiology. Hard to say. Lastly, they do talk about dry warmth diseases that consume fluids. These are usually seen in the autumn when dryness is predominant. So these are sort of like the Sangjuyin formulas for dryness that you may have learned. If you all have had the opportunity or not had the opportunity, please find the Lantern special issue. This is a free issue that the Lantern released in response to the pandemic with a lot of different articles that describe in way more detail than we have time today warm disease patterns and how they might be applicable to the pandemic and the patients that we're seeing. One of the, there's a lot of articles that Stephen Clavey wrote about, translated, Volker Scheid introduced the whole presentation. There is one interview with Dr. Ma, who is out in Seattle, and an article was translated by Craig Mitchell and Dan Bensky on what he was seeing in patients. As we know, Seattle was sort of the beginning of this pandemic and where the most patients were starting to climb before they started spreading more widely. And what he described as the way level pattern or early warm disease exterior presentation that's affecting the triple burner. As such, this is how they translated. This is as this is an exterior pattern, we should still resolve the exterior to get the pathogen to exit through the closest place, the body's exterior. However, one of the unique characteristics of the evil virus is the presence of damp turbidity in the exterior. Now, whether or not you want to think about this as being something that's attacking us or our body being able to process effectively on the surface, which is how we're thinking about it in our classic application of pathology, I leave to you. But damp turbidity is the key element to some of the applications we're going to talk about, particularly today when it comes to some of the Wen Bing formulas. We must use aromatic medicinals to transform dampness and turbidity. It is only through this method we'll be able to expel damp turbidity. Aromatic medicinals, you will see, make up the bulk of the Huo Xiang Zheng Qi. If we were to use a simple formula to promote sweating, such as Tang, for example, it's an exterior pattern, but it is not exterior cold. This is exterior dampness. So if we just promoted sweating, the result would be the wind would go, leaving behind the dampness, and the disease would enter the interior, which is to say you are not correcting the function of the exterior of the body. You are not working in harmony with all of the systems within the 6 channels, if you were to think of it from that perspective, or you're allowing a complication of the disease because you've not actually treated the dampness, which is the causative factor. So this pattern that shows up as the first stage of the disease, he says in his experience, the majority of these virus patients. And the most suitable formula for these first early stage patterns is the Huo Xiang Zheng Qi. So if we look back to the Wen Bing, which did have chapters on Huo Xiang Zheng Qi, even though, again, it was written 700 years before. It adopted many Shanghan Lun formulas, many Song era formulas. The Wen Bing chapters actually on Huo Xiang Zheng Qi are summer heat diseases. And there are some people that speculate that this has properties of latent summer heat and dampness that brood and lodged. And I don't know if I entirely agree with that principle, but the damp is fairly clear. So because damp warmth can present in any season, any stage, the initial stages when damp pathogens encumber and obstruct the muscle surface, causing symptoms such as aversion to cold, subjective feelings of heavy body, fever, scant sweating, slimy white tongue loss, and soggy moderate pulse. The paradigmatic formula is modified Huo Xiang Zheng Qi. This is the pattern that Huo Xiang Zheng Qi treats, and it is spoken about in the Wen Bing as such, which means we need to talk about dampness a little bit more. So dampness, as you all know, is, as I'm sitting here on a very rainy day watching it, it is turbid by nature. It lodges, it does not transform easily. And unlike cold, which resolves when sweating is induced, when the exterior is not performing its open outward function and is somehow trapped, we can resolve cold by sweating. If we have heat obstructing on the exterior, then we can clear it. But damp diseases are different. They're usually protracted, they're intractable. Remissions occur, this is really, actually, this sentence is very important. Remissions occur quite commonly even after apparent recovery. For any of you who have been seeing patients with this virus, this is one of the hallmarks of it, which really has been an experience to treat, because a lot of patients are in the, I am feeling better, I think I'm through the woods, and then they backtrack. And I really think this is due to the unresolved dampness, both interior and exterior, which we will get to. The core of DAMP transformation is usually the middle burner and disharmony in the spleen and stomach pivot. So I will get to this in just a moment. We're going to talk about the triple burner transformation of fluids and how they should properly be transformed. And if they are not properly transformed, that the center of the body is really the source, this qi dynamic. We talked about harmonizing the Xiaoyang last time. We're talking today about harmonizing the center and how we can transform fluid so it does not become dampness, or transform everything that's coming in so it doesn't become dampness. Another factor that makes DAMP really complicated in these viral presentations is that DAMP stagnates into heat more slowly during early stages, which is what Huo Xiang Zheng is treating. And the heat signs don't tend to be very strong. So we will see not a lot of heat in this pattern. Even though it's in the treatise on warm diseases, this is not a hot pattern. And in fact, all the herbs in the formula are themselves warm. So of course I went back and thought, well, how are patients actually presenting? So I went to the CDC website and I said, these are the patterns that they present. You go right to their homepage: fever, cough, shortness of breath. This is what we know that patients are presenting with, and they think, oh, I must be suffering from this virus in some way. And for most patients, this will start within 2 weeks of exposure. Most of the time between 5 and 7 days seems to be the earliest start, but according to the WHO, and most of these reports are coming from China and Singapore, they don't have as much information because we're still gathering it in this country. 88% of patients had fever and 68% had dry cough. So what about the ones that did not have fever? Or what about the ones that did not have dry cough? What else is going on with these patients? So that was something that resonated with me when I looked at the symptoms, and I realized why this formula was being used. Other symptoms include extreme fatigue and weakness. This seems to be an incredible hallmark of all of the patients that I have a handful of patients. It's not like I'm treating dozens, but they all are so knocked out. They tell me just walking from my bed to the restroom, I have to stop for a minute and catch my breath. I'm just so incredibly knocked out. Or I can only listen to podcasts. Even opening my eyes to watch TV is too much. Lightheadedness, dizziness, headache, a specific type of distending, heavy headache that we'll see in DAMP diseases, stomach issues of a myriad of types, which we will talk about. Sore throat can present on the early end, nausea and vomiting. Huo Xiang Zheng was written about as one of the formulas that was used for what is called sudden turmoil disorder. If you're familiar with that term, I think it's such a great term, the Huoluan disorder. Sudden turmoil is simultaneous vomiting and diarrhea, which sounds like sudden turmoil to me. And using this formula as one of the main applications is something that I have done historically for all different types of what you might think of as like a stomach flu or something like that. It is often thought of as a GI formula for that reason. And a hallmark of not just dampness as a pathogen obstructing, but also this particular viral presentation is this loss of smell and taste for some people seems to be one of their earliest and one of their most prolonged symptoms. So there are some people who've really gone through the full recovery and yet are still not entirely back to their full sense of smell and taste, which makes perfect sense from a dampness perspective. I did a little further digging on these gastro symptoms because Huo Xiang Zheng is really thought of as a sort of stomach flu formula. And these are all from the last several weeks. The American Journal of Gastroenterology did a review of patients, again, mostly from China and Singapore. 50% of patients had some GI symptoms. That's a lot of GI symptoms. So you're not seeing this listed as the main things to look out for when you see this presentation, right? Fever, cough, shortness of breath. Some patients have very low fever. Some patients have no fever. Some patients have outrageous fever, which goes on for many, many days. That's beyond the scope of this formula. But no fever, low fever, sure. But a lot of patients with problems processing in the middle. So we're going to talk about the poor appetite and diarrhea. You can go to the Cleveland Clinic page. They actually did some research into patient reports and found that the stool samples stayed positive for much longer than the respiratory samples for this virus. So we know it is hanging out in the digestive system for a long period of time. Interestingly, they also reported that a number of patients actually presented with digestive symptoms a couple of days before their fever and respiratory symptoms presented. So to just sort of be on the lookout for those kind of things as maybe being part of this pattern. They also presented another report where a few patients, but they could be the patients that you see who have GI symptoms and have no respiratory symptoms at all. A lot of these patients are not being tested, and testing being a whole other problem here. Access and quality, etc. There's probably a lot more patients who are presenting with GI symptoms and not respiratory that may or may not be included in the population that's affected. They did say if loss of appetite and loss of smell was included, though the GI signs and symptoms were about 1 out of 4, 1 out of 5 patients were going to be showing some GI symptoms as well. So it's not just respiratory. So going back to our Huo Xiang Zheng Qi, which is what we're talking about today. Again, this is a Song area formula. It is not a Shanghanlun formula. Huo Xiang itself as an herb is not even one of the Shenong herbs. It was used traditionally for summer heat, is probably what a lot of you remember it for, as a summer heat herb for when there's a lot of dampness and heat brewing and you need to steam out the dampness, as well as Huo Xiang Zheng Qi being used for summer heat kinds of patterns. Other formulas that were in the Imperial Grace Formulary seem very familiar to you, I'm sure. Pingwei San, Archen Tang, Chuanxiong Cha Tia San, Susijiang Qi Tang, and some of the tonics like Sujunzi Tang, Suwu Tang, and the ever popular Xiaoyao San. These all came from the same era and evolved as a response to perhaps some limitations to the formulary that was available for not just epidemic diseases, but treating patients with the standard Shanghanlun formulas. So because I'm used to interacting with students, I just popped over to the chat room. So fever is not mandatory. You can see low fever, you can see no fever, you can see high fever. It is a symptom that is not distinctive of anything. So we're going to just look at it in context when we get to it. The blood clotting is actually really interesting, and that comes on a little bit later and is a little beyond the scope of this particular presentation. So hopefully we'll be able to get to that in later ones. So let's look at our formula, Huo Xiang Zheng Qi. According to the Wen Bing, when it is being applied, it is used for the following symptoms: headaches with subjective sensations of distension. So this full sort of throbbing, achy, heavy sense will tell you there's a damp component, and this formula might be indicated. Chest and stomach duct dilations and oppression, fullness, feeling obstructed in the chest and in the abdomen. That obstruction is going to impair how well the transformation is happening in the middle burner, which really is the pivot for all the organs in the body. So how well we're taking in and how well we're using what we're taking in and eliminating it and processing it. If you're not processing it, you are going to get oppression and stagnation, and you may get some reversal in things like nausea and vomiting, diarrhea, vexation and agitation. These are some seriously vexed patients. Skin heat with sweating, subjective sense of heat, or tangible fever on a thermometer. And in severe cases, clouded spirit and deafness, which we are going to read as a metaphor for obstruction in your senses like brain fog. This is what some of my patients tell me. I just can't focus, I can't think, I have issues with my sensory orifices in seeing, smelling, hearing, etc. If you go to the formulas and strategies text, the indications for Huo Xiang Zheng Qi, which make you think, yeah, this sounds like early stage or mild stage COVID patients could really benefit from this formula. Fever and chills, headache, these suggest to you there's an exterior component. A sensation of fullness and stifling in the chest, pain in the epigastrum and abdomen. Again, obstruction in the transformation and processing in the middle burner. Nausea and vomiting, or borygmus and diarrhea is a sign that that transformation is reversing or causing some type of stagnation to cause a rebellion within that middle burner. The loss of taste and smell are included here. White greasy tongue coat, which is actually one of the hallmarks, it seems, of this particular pathology. The so-called COVID tongues are really something to behold. And because we don't have access to moderate sagi pulse, we're just going to assume that they have it. I have some practitioners who are trying to get their patients to take it, but I don't think that's going to work so much. All right, so how are we going to apply this formula? What are its actual functions? So Huo Xiang Zheng Qi is spectacularly good at releasing a mild exterior presentation. So helping with, if we translate it to our Shanghanlun pathology, processing at the surface. So helping opening and expanding and rising and clearing anything that's causing an exterior symptom. It is also incredibly useful. You will see when we look at the herbs at transforming dampness. It is comprised of a lot of aromatic herbs that will steam and transform. They are not heavy-handed in the way they do it because dampness will not respond. And most importantly, restore the normal qi dynamic, particularly within the center, within the taiyin, so that we can functionally transform this dampness and get the entire system working more efficiently. So starting with regulating the exterior. Kathleen, skin heat with sweating would be the subjective sense of warmth, perhaps with sweating, which I'm going to get to right now. So fever and chills are exterior presentation. We know that if we have some obstruction in this up and out movement, we're going to have obstruction creating some heat, and that obstruction also impairs the warming function, so we will have some chills. The aches and pains in the joints, the muscles, especially the head and the body, have the characteristic sort of heavy, achy sensation. And as I mentioned on the next page, that's sort of coming down with something feeling. I feel this heavy achiness. I think I'm getting sick. That's kind of characteristic of this damp on the exterior. Again, the pulse is not going to be so useful for us. The sweating on the exterior could be very mild, depending on how much dampness there is. It could be kind of dewy sweat or completely blocked, depending on your patient's presentation. So this is kind of a run through of those symptoms. And again, one of the most useful tools, even in telemedicine, if you've been able to see these patients, is the tongue. At this stage, meaning the stage where you have some early damp on the exterior with Huo Xiang Zheng Qi, you might not get some really strong changes. There might be a little puffiness or a little moisture or a little thin coat, but it's usually not as severe as it's going to get. If it's different for that patient, that might give you different information if they're an ongoing patient. Back to the lantern issue, how we are treating this dampness on the exterior is really important. So Dr. Jin Zhao has an article in there where he discusses emphasis is focused on this dampness, again, even in severe disease stages, where this formula is not for severe stages. It's really for milder, earlier stages. It is key to get the body's pores to be open and exchange materials of life in regular fashion. So that has to do with our processing on the exterior, how we are moving through the world and integrating with it. Very cold and bitter herbs can't be used precisely because they will lead the qi downwards and close the pores like doors. So the idea that you have heat being treated with cold and bitter, we have discussed before. Sharon presented that. Commonly bitter is the flavor of herbs that will drain heat down, but that's really important to know when and where the bitterness should be used. And things that are cold and bitter include a lot of the antiviral herbs and medications that patients are taking, including antibiotics and antivirals, and they will not release in the way that we want this damp to be released, but they will stagnate and pull in because the nature of cold, you know, is going to be more stagnating. We had the pleasure at the Shanong conference last month of having one of our main speakers, Volker Scheid, talked a lot. He actually uses a lot of Wen Bing theory. And he did in some of his discourse, this is sort of paraphrasing some of his discussion about how you address different pathologies on the exterior, what the effective treatment methods are. So that if you have cold and blockage of the taiyang, like in a Ma Huang Tang pattern, you must diaphoresis. If you have cold, rather if you have heat, the exterior is a little bit too open. So you don't treat it in the same way. And you would have more heat symptoms suggestive of a bohud-like formula or other cooler, spicy release exterior herbs that you might see in like a Sangjuyin or even Yin Chao San. What we're really focusing on is the damp presentations on the exterior that seem to dominate this virus presentation. So should not be using sweating as a treatment principle. It is best to promote fluid release through urination. Now, this is going to apply more to the stronger presentations than the Huo Xiang Zheng Qi, and Sharon's talk this afternoon is going to go into this in more detail. But I like the analogy that he used, that like a teapot, you must remove from the bottom. So you pour out a little bit, but you always have a little bit of venting at the surface, and the best way to vent is with an herb like Huo Xiang, which we will see. So that's our first treatment principles, resolving the dampness. So we know we have this damp, achy, maybe feverish, maybe dewy sweat kind of presentation in our patient. And where did that come from? How do they have this accumulation on the exterior? In my estimation, a lot of these patients kind of started out with some type of tie-in dysfunction to begin with, which made them more likely to develop this type of presentation. So accumulation of dampness will come from tie-in dysfunction and tie-in pathology, which we haven't spoken of so much yet. But as I started to reference, we have this relationship, a different kind of pivot in the middle, where the spleen and stomach work in right relationship to take in everything from the environment that we eat, that we drink, that we feel. So our emotions come through, our lunch comes through, everything comes through. And if the spleen is able to work efficiently, it can transform everything we're taking in, keep all of the good clear parts, and transform the waste products and get rid of them efficiently. If there is the inability of this pivot to actually turn because it's either overloaded in some way, which makes me think of like the healthcare workers at the hospitals in New York right now. They can't do their job as well because they're just overloaded. This is sort of how I'm thinking about the spleen in this context, but it's such a common disorder that I treat in my patients who just don't process well. Even if you have the most spectacular diet, I eat really clean. If your spleen can't transform it, your pivot is not working well in the center, there's no way you're going to be able to make good quality qi out of that and make good energy and transform it into the zheng qi you need to function well on all the levels, on all the systems of your body. So if that up and down pivot is out of right relationship and you're not getting transformation, everything gets stuck, and that will turn into dampness. So this pivot must be harmonized. This is one of our treatment principles when using this formula, but for tie-in patterns in general, is helping that pivot function better so that the pathological dampness can be eliminated from wherever it presents. This stagnation and poor transformation will tend to lead to this accumulation, which we call dampness and leakage from the body. In the introduction to the Shanghan Lun, they discussed this tie-in disease as resulting from possibly unresolved yang channel disease, damaging spleen yang. So something was not transforming well, either at the level of the tai yang, the yang ming, or the pivot of the xiao yang. And there is some damage coming from that, or that there was some direct damage, if you're thinking about the pathogen principle, or internal damage, which is I think really epidemic to a large part of my patient population in general, but particularly in this presentation. So are these the people that are going to be more subject to getting these gastro presentations? I think so. I did want to bring in Sharon here because I think she really has a great way of articulating it. I was going to paraphrase, but I think it's better to just quote her directly so I don't misrepresent. The function of tai-in is to absorb and steam upward the warmth, nourishment, and moisture from the products of digestion as they move down the digestive tract. And I will include everything that moves through our body has to get processed at the tai-in pivot. So if it is not pivoting well, the pathology can be summarized as a lack of absorption of warmth, nourishment, and moisture. So all of these will be impaired, and there will be fluid loss or accumulation rather than absorption. So you will see things like diarrhea, you will see things like damp accumulation, and some of the internal damp symptoms we're going to talk about. The treatment of tai-in restores the storage function of absorption and steaming, which is essential for our body to function as well as it could. Briefly, Sherry, how many days are considered to be an early stage? It really depends. It could be hours. These patients change so quickly. And it's super important that you are in touch with your patients, not just on the initial stages, but as they're moving along. I have patients who I'm treating, I speak to once or twice a day as they're going through this. And if they are able to get in touch with you when they're starting to show these types of patterns, you may be able to help them process this a lot better so they don't actually fall into the deeper, more complex, more life-threatening conditions. I mean, this is something that I've never worked with before. So it's really hard to say. I will say that it's easy to miss this stage, that patients progress really quickly, and you may not have the opportunity to see this. So dampness on the interior, we're going to feel as fatigue. Again, you don't have access to making good quality qi because you're not transforming well, so you don't have energy. If you have obstruction in the middle, described either as fullness, heaviness, being stifling, oppressed, or actual pain anywhere in this middle to upper burner area, this transformation in the center is impairing how well the clarity moves upward through the upper burner and downward through the lower burner. So if you're feeling full and stuck, you are not feeling hungry. And I will tell you, most of my patients have terrible appetites, not only because they can't smell and taste their food, but they're just not processing everything. It just is kind of sitting there. In some early stages, they will not be able to absorb and process at the Taiyin, so they just have diarrhea instead. I do have other patients who get constipated, and in some of the more extreme presentations, that's a little more common. Nausea and vomiting is sort of the classic pattern that we think of Huo Xiang Zheng Qi and how I've used it classically, again, for that sort of sudden turmoil presentation. The pulse, again, not super helpful, but the tongue can be incredibly helpful. I brought you some pictures today, very briefly, just to give you an idea of how we're going to see this dampness. And these are actually some of the patients that I'm treating now. So the one on the left is a little bit of dampness that you can see swelling in the tissues of the tongue. The one in the center and the one on the right are far progressed beyond this formula, but you can see how the dampness starts to really bake in on the tongue and actually causes impairment in the body fluids with the woman in the center. The woman on the right actually was a much more advanced stage. And you can see she's starting to show signs of heat, signs of blood stasis. So how the dampness progresses throughout the whole series of disorders that we see. So in some of the training that I have through the Dr. Functional lineage with Suzanne Robideau, this sort of resonates with how I understand Taiyin disease. Abdominal fullness and vomiting, inability to get food down, severe spontaneous diarrhea, and periodic spontaneous abdominal pain is how we understand Taiyin disease in the Shanghanlun. If you purge that using bitter cold substances, you will essentially create more complications and hard bind below the chest, which essentially means you are stagnating that middle pivot even more. So it is the exact wrong treatment to use bitter and cold drugs and herbs for these types of patients. Taiyin disease should be treated with warmth, not with purgation. If one fails to heed these words and erroneously purges, this will increase the vacuity of the stomach and room dampness accumulation, which will result in transformation of cold, manifesting with the hard bind. So this is really important when you're treating dampness diseases in general, but especially in this syndrome. The third treatment principle that Huo Xiang Zheng Qi, which is actually its name, Zheng Qi means to rectify the qi. So if the dampness is transformed, you can enable Taiyin to function properly, and that middle burner pivot is able to transform everything that's coming in and moving through efficiently. And if that is transformed and the Taiyang also is resolved, then you have proper processing at the surface as well in the center. You correct the dynamic in the center, the qi will be rectified. So essentially correct. We have all of these dynamics that need to be harmonized, right? Yin and yang, qi and blood, yin and wei, the xiao-yang. Here we're focused on the spleen, stomach, and the center, which is really essential to the functioning of both the upper and the lower burner. So if we remove the blockage, we will restore the function, the right relationship of that middle burner dynamic returns, and our signs and symptoms should resolve. Let's finally look at the formula. You can tell just by glancing at the formula that this is not a Shanghanlun formula because it has 13 herbs in it. Shanghanlun formulas tend to be these nice little discrete formulas that you can kind of combine in different ways. And Huo Xiang Zheng Qi actually, although it is kind of a big formula, has other formulas contained with it that are very familiar to you. So obviously leading the parade is the Huo Xiang. If you look at the dosage list, the second column, you'll see some very high doses followed by some in parentheses. The high doses are actually from the original form of Huo Xiang Zheng Qi, which was a powder. So that those were the powder doses, the 90, the 60, the 60, the 30, and you make this giant powder draft that you decoct in water in a powder form rather than a raw herb form. The ones in the parentheses are actually if it was in the Tang or decoction form. So you're using 12 grams of raw herb as opposed to 90 grams of powder and making this giant vat of Huo Xiang Zheng Qi powder. The other thing I want you to look at before we go through the herbs is the channels and the properties of the herbs in this formula. These are all upper burner, middle burner herbs, every single one of them. So they're harmonizing the function of how well the exterior is functioning, how well the interior pivot is functioning. So they all directly treat this pattern presentation that we're seeing. And the acridity, which is really the lead property, this is a warm and acrid formula. There's not a single herb in here that is cold. Not a single one is bitter. Some of them have little bitter components, but they have an acridity that helps them expand and open and steam and all the things that we want dampness to do. And they do it with warmth. So it's interesting that this was adopted into the treatment of warm diseases, but it really is about damp warm diseases with the accent on the damp. Some of the formulas that are within the Huo Xiang Zheng Qi that may have influenced its development. Tang is one of the earliest. That's a Jingui formula and a little bit more mild than what we might need for our patients, but every single one of these herbs is in the Huo Xiang Zheng Qi. This is a formula I use a lot in clinical practice. It is one of my favorites. Pingwei-san and Tang were actually developed at a similar time at that Taiping Song era. And they have similar principles. These are all damp formulas. So the Pingwei is cold damp that we see in the middle burner. We have a little bit of warming, a little bit of transforming. Tang, which takes into account the upper and middle burner, transforming the accumulations that can be phlegmy. A lot of people think of this as the plum pit formula. I use it a lot for digestive and respiratory disorders of various stages in combination with many formulas. And Tang, which is sort of our classic damp phlegm formula. So of course there's got to be elements of that, the two aged. So if we're thinking about this in terms of how we can apply a formula, which is thought of as a Wen Bing formula, though written much earlier and incorporated into some of the principles of the functioning of our conformations, we really want Huo Xiang Zheng Qi to help the Taiyang resolve the exterior in a way that it is properly processing the damp accumulation, and the Taiyin in the center properly processing dampness on the interior. So the ingredients of Huo Xiang Zheng Qi obviously are led by Huo Xiang. Its name is in the title. And if you remember how formulas are constructed, usually there's a chief who has deputies and ministers and assistants that kind of help its function in different ways. So the functions of Huo Xiang really are the functions of this formula. I think of it as a Taiyin herb. It really has this lovely aroma to it. If you know patchouli, which you might know from many different sources, it is a very aromatic herb. So it really opens and steams dampness, but both on the exterior and on the interior. So it's a great herb for these early kind of coming down with something achy colds that have a digestive component like nausea and vomiting. It is a very spicy, warm, light opening herb that will help resolve the exterior, and you can see it in its presentation. It's this beautiful spreading, opening, aromatic herb, and that's exactly what we want the formula to do, is lightly steam through the surface and process the dampness with a little bit of warm acridity in the center. I did specifically refer to this as a patchouli formula. Many of you might know this as the Agastache formula. But one thing that I learned from Eric Brand, who is a scholar on these things, that the Pogastamon version actually is the preferred version of the patchouli herb. There are two different ones that might be known as Agastache su Pogastamon. They're considered interchangeable, but if you can get the Pogastamon, that's actually your preferred one. It has stronger functions. The deputies, we have two sets of deputies that are going to help the Huo Xiang function to resolve the exterior and resolve the lack of transformation on the interior at the Taiyin level. And these are both One is a peel, one is a bark, the Hopua and Chenpi, which reinforce the actions of the chief herb, the Huo Xiang, to transform dampness. We just went through magnolia season here where I am in New Jersey, and it is breathtakingly beautiful. All of the little silky pink leaves that you can see, petals rather, have fallen. But we can still use the bark to help us with this down-bearing function, transforming dampness. Hopua itself, although not strongly aromatic, Chenpi, also an aromatic, have that same sort of steaming, warming, transforming, but down-bearing function. So that if we have nausea and vomiting, we can regulate that. And some pressure in the chest. One thing you might have noticed I haven't mentioned a lot is coughing in this particular patient. And this is sort of the stages where patients don't have a lot of cough, but they might have a lot of stagnation and a little bit of phlegm accumulation in their chest, or pressure and fullness. I had one patient who was getting a lot of belching. She just couldn't stop burping because she felt so much fullness. And if she moved a little bit of that through, it actually made her feel a lot better. So important first deputies to revive the spleen a little bit with their aroma, help dissipate a little bit of the dampness through the chest and the middle, both down-bearing herbs, drying herbs. Okay. And the second deputy group, whoops, went a little far, sorry. Second deputy group, also aromatic herbs. Suye, as part of the perilla family, is the lightest of them. It has the purple on one side, the green on the other. You've probably all seen the perilla leaf in your sushi collections. One of the loveliest aromatic light herbs that's similar to the Agastache, well, whatever you want to call it, the patchouli, helps open and lift the exterior, but has the ability to transform dampness on the interior so that it helps with nausea and vomiting. I use this a lot in, for example, morning sickness, or sugung, the stem, as well, for patients who are having nausea and vomiting with morning sickness. It's very light, it's very well tolerated, and it's really helpful to regulate the taiyang and regulate the qi dynamic in that middle burner by down-bearing it. And it's combined with Baizhi as a second deputy, which, if you have ever smelled it, is one of the most aromatic herbs. I always thought it smelled like pancake syrup. It's a little bit intense, but it's really aromatic. It tends to open upward, so it's really good for these frontal headaches that are heavy and achy, or sinus congestion that you might see with the dampness that's accumulating on the exterior. So lovely deputy contribution from these two. Then we move into a few assistants. The first level of assistant work together to down-bear qi and dry fluids. So banxia, as it is included in banxia Hopua Tang and many, many other formulas, is used specifically because it strongly down-bears qi in the lung and stomach. It helps stop vomiting. It helps dry damp phlegm in the center. It is one of our most drying herbs, and in combination with dafu pi, which works a little bit lower. So it will regulate like the Hopua and the Chenpi, but work a little bit lower. So if you, I remember one of my teachers saying dafu pi was called the big abdomen peel because it looked like a big abdomen, and it's used for the sort of swelling, fullness, distension that you might see in the abdomen associated with dampness and non-transformation in the center. Our second assistants bring another component to the formula, which is not just damp transformation. These are both drying herbs, Baizhi and Fuling, both dry dampness, and they are a classic dui yao for regulating the taiyin function. So they work together to not only dry dampness, but also support the taiyin. So these actually make this formula a taiyin supporting formula. They strengthen the spleen's ability to actually function, transform, and have, particularly in the case of Fuling, a mild diuretic action to drain a little bit from below. So to help move the fluid through the body in a way that's going to be helpful and not harmful, not drive it deeper. The third assistant, this is one of my all-time favorites. This is actually a photo from my garden from last summer that I'm sharing with you because I just love this herb. Jiagang is in a lot of the formulas that we've seen because it's so important to open and expand the lung and really get that qi transformation in the upper burner moving. And you can see it in the platycodon flower. They're this brilliant purple-blue color, and they sit, you can see, like a balloon. That's why they're called balloon flowers, and they open up to the sun. So you can see the petals are just starting to open on this one. It grows beautifully here. It's one of my truly favorite herbs to use clinically. Obviously, we're using the root of the jiagang. but the flower is pretty spectacular too. And lastly, the formula that would never end is the envoys. Now, these are three of the most important envoys in so much of the formulas that we use in Chinese medicine. The Jiang Zhao Cao triple hitter. This was something that we called, and I've used this term with my students for many years, the three amigos. And the three amigos, the fresh ginger, the dates, and the honey fried licorice are used together in so many different types of formulas where you need to supplement the function of the middle burner so that the taiyin can actually absorb better, transform better, steam and warm better. So they all have this sort of warm sweetness that help them really make the taiyin function well. So, and you'll see this in so many formulas, right? We saw this when Sally spoke about Guizhi Tang, how we needed to support a little bit of weakness in the interior with the Jiang Zhao Cao, or Xiao Chai Hu Tang also supported a little bit of weakness in the center, or Xiao Jianzhong Tang, which is actually a Guizhi Tang modification, but how these herbs actually work to support the functions that are not working well so that your body can essentially function optimally and you will not get continually more sick. So traditionally, as I mentioned when I presented the formula, this was ground to a powder, hence the san name. So this is a little bit different than granules. My understanding is granules are prepared traditionally as a decoction and then made into their granular form. The Jusan traditional san preparations that were pretty popular with Pingwei san and Xiaoyao san and Huo Xiang Zheng san in the Song era were actually grinding the raw herbs to a powder and cooking the powder. Now, all the herbs were done this way, except for the fresh ginger and dates. You actually would throw a couple of grams of ginger and maybe a date or two into the cooking brew of your powder, your jusan, and you take this draft together to treat the syndrome that we've been discussing. You can prepare it as decoction in the lesser doses. As I mentioned, they exist in the parentheses, but usually it's a fairly short cook time, because again, we're working with aromatics to help steam out dampness. And as long as you have aroma, you risk cooking it off and losing the benefits of the formula as you're moving through. So some of the modifications that you might be thinking about for this formula, again, there are plenty of herbs doing a lot of things. If you see a lot more dampness in your patients, for example, their tongue seems more swollen or coated or moist, or they're having a lot more diarrhea, it might be recommended that you use SHANG. And we can actually maybe tap Marnie to comment on this, but I have seen that there's some Pingwei differentiation where if you have more achiness in the body as well as more dampness and you're not sweating as much from damp not perfusing through the exterior, you might choose Sangju more, whereas Baiju might be used when you have more weakness in the middle burner, more deficiency, and you actually have more sweating because Baiju has that function a la Yuping Feng San to stop sweating. If your patient has more diarrhea and you need to treat a little more acutely, you can use a Chao form of Baibiando or Yiren to help the fluids transform a little bit better and stop the diarrhea. In the case of exterior signs and symptoms, Jingjie and Fangfeng are a common modification. So Jingjie and Fangfeng, a lot of exterior presentations, but if you had more congestion or other signs and symptoms, that were a class of an exterior presentation. In the scanty urine type of patient who might be suggesting to you that fluid is now accumulating in the lower burner, Fuling might not be enough. So you might need to add some diuretics to help actually drain out a little bit through the lower burner, like a Mutong or Tongxiao, depending on what's available to you. So I know some people can't get Mutong or Zuxia to help transform fluids a little bit. How am I doing for time? We're cruising here. Okay, we're almost done. Oh, this is my last slide. Yay. Okay, so Sharon is going to be talking about this formula along with Sanmen Tang, and I was going to do a little bit of comparatives, but I'm going to leave it for her to do and expound upon. This is actually a combination that clinically I think has been more useful for me for the patients that I've seen. Because again, the Huo Xiang Zheng pattern comes very quickly in some patients, and unless you sort of have your patients trained to get in touch with you, as soon as symptoms approach, you might miss them and they might start progressing a little bit more, so that the encumbrance on the lungs and the impairment of the qi dynamic in the middle starts really impairing the chest a lot more. So the fluids are stagnating more, the chest pain is more, and you're starting to see more cough. So you might need to do more draining and opening in a different way, which would lead you more often to maybe like a Huo Xiang Zheng. I've used a lot of Xiao Chai Hu Tang variations. This is one of them with patients. And again, Sharon will expound on this a little bit more this afternoon in a few hours after this presentation. I did really want to get for you a pure Huo Xiang Zheng Qi San presentation so you can see what it looks like, but I think you get the idea of the picture. But again, most of the patients I've seen have really progressed more into this Xiao Chai Hu stages or further into Ma Xing Shigan stages, and sort of where we're starting to see a little bit more depth into the lungs. But if you have digestive dysfunction, some exterior not resolved kind of presentation, so you're not perfusing really well, Huo Xiang Zheng Qi San might be a great one to have on hand. There are versions of this I know that come in liquid form, so you may be able to get some version of that and have it handy. It is great for sort of these stomach bugs that pass through that people might get a little bit of febrile presentation with. It's a great formula to know anyway, but in terms of treating these types of patients, it at least gives you a glimpse into how the pathology is progressing and how you can treat it in some of the more milder presentations and then modify it accordingly, according to your patient's presentation. So I was going to go in so many other thousands of tangents, but I'm actually going to go ahead and stop there. And if you have questions, I'm happy to answer.
So now we're going to go into a bit of Q&A. We keep mentioning there's other courses in this series. So I just want to let you know, when you go to the resource page, and by the way, Carolyn, brilliant. Every one of the speakers that has been in this series is brilliant. So hats off to Sharon Weizenbaum's graduate mentorship program. And again, Carolyn, for all the people that have spoken so far, if you want to create a comprehensive course, I'd love to have you on my platform, because I look for high quality content, and this is high quality content. So thank you for putting together an excellent presentation for all of us. So for the upcoming, as you can see, Sharon's going to do one in a couple of hours. So she's going to do Sun Tang. And then you can just see for the week, we have a whole bunch of things happening. We have one tomorrow on herbals for fertility. We got a naturopathic one about the cytokine storm. Heiner Fruhoff's doing one on Friday. And on Friday also, we have Jennifer from this group doing one on Hopo Ma Wang Tong. And then we have a CEU course on the weekend. So lots of fun stuff. So if you go to the resource page, we keep updating that. So I just want to let you know that's where you can find it. And then if you click on this, again, where's the replay? What can we do? If you go to number 6, you click on it, it takes you here where you can register. So right now, if you haven't registered for the one later today with Sharon, click on this link because it's a different Zoom room. And then the one on Friday is available now. So you can start to register for that. And then if you want to watch the replay, click on here and it'll take you to this landing page where all the series are. And we'll work on something. People have asked for handouts, so we're working on an idea for you guys as well. But you can see they're here. We're going to keep them up until the end of April. All right, let's get into some Q&A. And again, a big thank you. And stick around at the end when we open up the mics, because to me, that's important for us to keep that community going. So we're going to go to Osbin. I'm just going to unmute you. There,
Hi.
you have audio.
Hi, can you hear me?
Yes.
Oh, great. Thank you. Thank you, Carolyn. It was a great presentation. My question is, I guess you partially answered with the last slide. You combined Xiao Chai Hu Tang with this formula. But if I were to stick with Shan Han Lun, I was looking at each symptoms, signs and symptoms, and it's like trying to put in Shan Han Lun perspective. I was thinking Taiyang, Shaoyang, and Tai dampness, and then trying to pick up, create a formula. The first thing came to my mind was Xiao Chai Hu Tang with Fu Ling Yin. But then there is some exterior, and then I went back to Chai Hu Gui Ji Tang plus maybe Fu Ling Yin or Ban Sha Ho Po Tang. So do you think if I were to give this kind of formula instead of combining Huo Xiang Zheng Qi San, do you think my diagnosis and treatment would be wrong, or I might harm the patient because I'm giving guiju, chaihu, etc. Even though I'm kind of close to this formula without Huo Xiang and Dafu P.
Right. It really depends on the exact presentation of the patient. So if they're really showing signs of dampness, either internal or external, you want to make sure you're addressing that. It's kind of a hard question to answer. Sharon, I don't know if you heard the question. She's also going to sort of expand on that last formula a little bit this afternoon. So that might be more helpful to understanding the answer to your question. But some of those ideas of supporting spleen, transforming dampness, as long as they match your patient presentation, it should not be essentially harmful. I think the biggest concern here is you don't want to just promote sweating, because that would be wrong, or you don't want to just use bitter colds, because that would be really damaging to your patient. So Sharon, did you have any thoughts on that?
Well, the question is sort of like some of these formulas that we're going over today are not Shang Henlun formulas, and could we treat the same situation with a Shang Henlun formula, and how would we translate it? It seems like that's kind of the core of the question. What would we do with a Shang Henlun formula if we were going to try to mimic the actions of it? And I think some of the herbs are just so wonderful, like Huo Xiang and Peilan, that are light and aromatic. And, from a Shang Henlun perspective, what do we have? We have Cangju, is kind of the herb that has that quality of being fragrant and going into the flesh and opening up the exterior. And we also have kind of complex formulas for mixed patterns of heat and cold. So what do we do for things that are kind of, quote, damp heat, and where that damp heat is in different locations? So, I think that it's entirely possible, and really it sort of depends on your experience, I think. Like, having experience with a formula like Sanren Tang or Huo Xiang Zheng Tang, you start to like those formulas and feel confident in them. So you just go for that instead of trying to look at that from a different perspective. I think also there's like the UAB Jiaju Tang is another formula, right? That is going to treat damp heat on the surface of the body. And that combines a Ma Huang and Shi Gao and Cangju. You can use Cangju for that. So I do think it's possible. But I also think it's possible to look at these formulas from the point of view of Shang Henlun physiology, which is what Caroline's been doing and also what I'll do this afternoon. I don't know if that answered your question or not. But,
Thank you. So before we'll wrap up, we're going to open up the mics. And again, I find this an important part for us to just connect. When your mic's open, we start to collect your voices and you start to show up on the screen. I want to just express some gratitude. So Sharon, thank you for coming up with this idea and organizing this, bringing your colleagues together. Carolyn, thank you for an amazing presentation. Really enjoyed it. And I just watching these presentations, I mean, all of them, we have this series, but just everything that's been on our resource page so far, there are some brilliant, top-notch practitioners that are presenting. It makes me feel really good what we have in our profession. And then I know some of you on here, and you guys could be doing the same thing. So we got a really good tribe happening, and that makes me feel pretty good on the inside. And then I want to just express gratitude to Sandro and Lorianne. I'm part of Healthy Seminars team because the three of us are going with lack of sleep, but we're loving it. And as long as we're in isolation, we'll keep putting out content. We've been putting out daily, often twice a day, twice on Monday, twice today, twice on Friday. There'll be 2 webinars. When isolation gets lifted, we will continue to do these resources, just not daily, but we'll definitely keep doing this. And I want to thank you guys for showing up, and thank you for your questions. So let's open up the mics, and guys, send your love and appreciation to Carolyn and to Sharon and to Sandra, Lorianne, and to each other, and have your chance to connect with each other for about a minute.
Thank you so much, Carolyn.
Thank you
so much.
That was amazing.
Beautiful job.
Really appreciate all the great knowledge. Sharon and Lauren and the rest of the team.
Really great. Thank you.
Everybody.
Fantastic.
All that you guys do.
Great.
So much.
Thanks, Caroline. That was great. Wonderful job.
No way that y'all feel like taking up.
Everybody.
Thank you very much, Caroline.
Thank you so much. Bye bye.
Thanks, Lauren, for putting this up.
Lauren,
Sharon, for thinking of it.
Thank you.
Thank you all.
Thank you.
Thank you, everyone. It was lovely.
Thank you so much.
Thank you.
Thank you.
Thank you, guys. There's another one happening in an hour and a half. So we have another one happening. There's another one happening in a little bit of time, noon Pacific Standard Time, 3 o'clock Eastern Standard Time. So it's a different Zoom room. So please do subscribe to that, and you'll get the link for Sharon's presentation later. And I'm going to tell you that I'm going to do a Conscious Tuesday next week on the 28th. And so if you're interested in calm in the presence of uncertainty, I'm going to share the science behind getting into the present moment and giving you some tools and gimmicks. They're literally tools and gimmicks to get you to present moment. And so I'll share that on Tuesday, April 28th. And guys, stay safe and keep our community strong. I'll see you guys in about an hour or so with